Hi everyone. Today we're going to be looking at the second part of this session related to co-production research, and we're going to be looking at co-production in practice. So about me again, I'm Dorothy Newbury-Birch. I'm Professor of Alcohol and Public Health Research at the School of Social Sciences, Humanities and Law at Teesside University. I lead a team of 20 researchers and PhD students, and for this project I'm leading Work Package 3 with Dr Gillian Waller, and I am providing public health and co-production expertise to the project. So what we're going to do today is to understand what co-production research is in practice using a case study. And this is a case study that I've been involved with for a number of years now. So what we do with Durham County Council is we work in collaboration with public health practitioners to work on all aspects of an evaluation. The researchers and the academics each hold an honorary position at the other institution. This facilitates the sharing of knowledge and experience and provides time and space to work together on projects. So we're researchers in residence. So the researcher on this project spends 1 day a week within the county council, or did before COVID, working face to face with the people who we work with. So it all began in Durham, 10 years ago, where Claire Sullivan on the left here, Dr. Claire Sullivan, who now works for Public Health England, and I were having a chat about small pieces of research. And from that, we came up with an idea that could the council pay for a researcher for a year to do 3 or 4 pieces of research rather than getting them done separately and people coming in and going out again. You'll remember we talked about this, about parachuting people in the first session. So Claire went on to do her PhD with me. She graduated last year with her PhD. And when she went over to Public Health England, Jill O'Neill took over. She is Deputy Director now of Durham County Council, and she's in charge of the co-production work there now. It's been really important that we have kept that relationship going for 10 years now, and we've learned through the thick and the thin of what they want from us and what we need from them. But of course, during that time there has been a huge decrease in monies that are available to public health. So when we started, it was easier for the practitioners to be able to work with us, but we went through a significant period of time where they could do very little in terms of the projects. So we had to work out how we could make it work with less input at different times. We were just about back on track before COVID, but now, of course, COVID has struck and public health are dealing with the pandemic. However, because of the relationship we have with them, we've actually been able to work with them on a wellbeing project around COVID, which is going to be useful to them, of course, in terms of looking at COVID recovery. So we've done a number of projects. These are just some of them. So we've done something around youth aware of mental health, which is a mental health intervention for young people around suicide ideation. And we know that it works from a randomised controlled trial carried out in Europe. So we have carried out a implementation study in terms of how do we get it implemented and what do people think about it. The safe and wellbeing visits, which we're just writing up now, were about the fire service when they go out to people, delivering advice on a variety of different things. And we've also just finished a project looking at a warm homes campaign. And we've been working with Macmillan in terms of a bereavement service for people with cancer. And then Operation Encompass, which is about young people, kids and domestic violence, which I'm going to talk to you about a bit about. So when we started this off, we had a really nice figure of how we thought this would work, and look at all the lines, they all go through to people, and this took a lot of doing, I can tell you, to do this. But in fact, the reality is it looks more like this. You know, you've got NHS ethics as well as university ethics. We've got Caldecott approvals. So it's about working out who needs to give permission at certain points in a research project to enable that to happen. So Operation Encompass is something that the project manager, the research project manager, Dr. Natalie Connor, has been working on for a couple of years now. It's an initiative that enhances communication between police and schools where a child is at risk from domestic abuse. And this has happened, you know, this Operation Encompass is all round England. And it's the idea that the schools are aware if something is going on and they can put things into place for those children. It complements existing safeguarding procedures. So the primary aim of the evaluation was to look at the implementation of Operation Encompass within pilot schools in County Durham. And we conducted a process evaluation to look at the feasibility and sustainability of the model. So in order to do this, we looked at descriptive process data, number of schools engaged, number of notifications, age, gender of people's involved with notifications, and any absences noted after a domestic violence incident. And of course, the local authority were much more able to get that information than we would be. So we had, in terms of quantitative data, an anonymised data dump of notifications for a year, and then another one of individual notifications from the school. So that looked at age, gender and absences. We also did a lot of qualitative work, so focus groups with school staff, with the steering group for Operation Encompass, police staff, delivery staff. We did a survey, and then we did a load of interviews as well. So what we found was that 489 notifications were sent within that just under a year. We found that some of them didn't have the right data on, so that was a really important piece of information. So 113 was sent via email before 9 a.m, so they were there before school started. A lot of them, the majority of them, were sent before 11 a.m, and some of them were sent after 11 a.m. And it's really important that the schools know about it ASAP the next day. So this was really important for us to know. So in terms of Durham as a whole, we've completed 13 evaluations. The majority of services have continued, although changes have been made in line with evaluation findings. One service was decommissioned as not deemed cost effective. One pilot strategy has ended with recommendations made for future commissioning. And I think, you know, with all them public health cuts that have come, we were finding that these became more and more important, these evaluations, to enable the public health staff to be able to make decisions, and very difficult decisions, about which services they should continue with. But it's not just what we've done at Durham. This has garnered great interest right across the country. And in fact, we've just started working with Middlesbrough Council to do the same sort of things that we're doing in Durham. And we've learned such a lot from that. And we know there are other areas in the country that are doing something very similar. We've presented at numerous conferences across the UK and, in fact, abroad as well. And we try and do that with one of our practice partners. And often they will present without the academics. And so it's really, really good. We come up with a poster or a presentation and anybody can use it. And we've produced a number of peer-reviewed publications, and this is the peer-reviewed publications. We've had, as you can see, quite a lot. We've actually produced a book that was published last year around how to do co-production research. So a lot of the projects are actually talked about within that. And it's really important that we do things like this to get that work out there to show how this can be done and what the results are when we do this. And we've been successful in national impact. So we did a small study looking at suicide prevention, and we worked closely with Public Health England, and actually the way that we did it was included within their prevention planning that went out to everybody across the country. So we were able to notify on that. And then after this, we did another piece of work across the country looking at suicide surveillance. So it all adds up and adds on to something else. And it's really important that small pieces of work like this can really start making an impact at national level. So in terms of what we've done, we've examined that case study of the history of how it all came into being, all over a cup of coffee at the beginning, and how that has continued over the time. I've put some further reading up here. It's the same as it was on the first one, but you can also look at some of our papers that I've just shown you that will help you in terms of seeing how we've done it and what we've done. Thank you.